Hi, my name's Elizabeth Wilson, and recovery is possible. I joined Burrell after being a client. I was a client for 7 years. In that 7 years, I got tools to help myself lead a better life, to help myself stay out of the hospital. My last hospitalization was like 36 days and cost me a job and a career. And I just wanted to have my power and my stability, my ability to function. One of the things that I encountered at one of my previous jobs was talking about being on disability for depression and anxiety and mental illness. And I had the opportunity to hear somebody say, well, I wish I could get paid for being depressed. And that's not what it's about. And I left that room and just cried, because it's not what it's about. It's about taking each person individually and dealing with their struggles. It's about taking each person individually and seeing them as a person and needing to know what they want as a person and helping to effect that change. And part of what helps me is being able to share that, hey, yeah, I've gone through this thing that you've gone through. It helps me to be able to give somebody hope. That's what my job is about, is helping people and giving them hope and giving them a way to get out of where they're at. Giving them a way to say, okay, if she can do this, I can do this. A lot of what gets people stuck is past, and that past doesn't always stay in the past, and that whenever it doesn't stay in the past, that's when we need the extra help. That's when we need the personalization of not just being a number, but being a name, not being a illness, but being a person. I want our community to know that it's real. I want them to know that having mental illness is okay. It's not something that necessarily gets gotten over, but not doing anything about it is what leads us to be stuck in the then and there. But if we can find something that we can do about it, if we can have the resources to get our medicines, resources to support groups, resources to teach us the tools that help us to move forward, that help us to get better. And people that knew me, 10 years ago would probably never have believed that I would be where I am now.